Hello. My name is Jones, and today we are looking at chronic condition causing frailty in the elderly and their management. Okay, so in previous lessons, we identified the frailty as one of those conditions that affect geriatric clients. So in this lesson, we are more interested in the management of those conditions that affect the elderly. As earlier established, frailty is a state of increased vulnerability due to diminished physiological reserves that leads to reduced ability to cope with stressors. So, frailty is characterized by weakness, slowness, fatigue, low physical activity, and unintentional weight loss. Frailty is a state of weaknesses that we see when one is aging. They become frail, they become weak, but it's not just weakness that we see. So we see weakness, we see slowness, we see increased fatigue, we see low physical activity, and unintentional weight loss. So a case of increased vulnerability, okay, where we see all this is frailty. Okay, so now when one has reached 65 years and above, or during senescence stage, that is old age, there are many conditions that will cause them to be frail. So a list of conditions that we have established include lifestyle diseases or non-communicable diseases like diabetes mellitus. We have established that some of the conditions that will cause frailty is lifestyle diseases or non-communicable diseases like diabetes. We also have hormonal diseases or hormonal issues that may cause frailty. Okay, in as much as diabetes is a non-communicable disease, the hormone that is responsible for regulating sugars is affected. Hence, you see type 2 diabetes. So there are hormonal issues. There are many hormonal issues that we can talk of, especially like for females. There is decreased production of estrogen. So this also comes with its challenges. Okay, then there are nutritional deficiencies that will cause frailty. Okay, so that is why when we are recommending something to do with management, there should be something to tackle nutritional deficiencies. Okay, then there are also hepatobiliary and other gastrointestinal issues. So when you say hepatobiliary here, we are just relating to liver function. Okay, and as if the liver is functioning well, also the digestion part also will just function well. So there are hepatobiliary and other gastrointestinal issues that may bring about frailty. Then there are urogenital and renal issues. There are urinary conditions affecting the urinary system that may bring about frailty. Okay, kidney problems. Okay, remember the kidney is involved in production of red blood cells through the chemical hormone known as erythropoietin. Okay, then as one ages, because of decreased metabolism, there will be also failing homeostasis. Because of reduced metabolism, it becomes very difficult to maintain homeostasis. Then to do with memory, also if there are memory losses or neurological issues, it may also lead to frailty. Remember, I talked about dementia, Alzheimer, as some of the conditions that may cause frailty. Okay, so When we talk of neurological issues, it includes also failing sensory organs. Then there are also cardiovascular conditions that affects the heart and respiratory system that may cause frailty. Okay. Then we also have vascular hematopoiesis or lymphatic issues. We have immune issues that may also lead to frailty. And then we can also talk about osteoporosis that affects locomotion, okay, and other orthopedic issues. So orthopedic issues, arthritis, and the likes will be one of those conditions that we see in old age. Okay, so others, remember, they are genetically predisposed to cancer, so we also see malignancies in old age, so it can also cause frailty. Okay, so for the purpose of this discussion, we are going to appreciate the following chronic condition, their association with frailty, and the management strategy. So the conditions will include hypertension, chronic kidney disease, osteoarthritis, depression, diabetes mellitus, chronic obstructive pulmonary disease or asthma, heart failure, stroke, and peripheral arterial disease. These are some of the conditions that we are going to concentrate on as chronic conditions that are associated with the frailty. So if one has hypertension, how then will it bring about frailty? There is if one has got hypertension, it exacerbates cardiovascular strain. Your heart easily become tired, okay, or become stressed. So if an elderly person has hypertension, expect some frailty, okay, some slowness, some weaknesses also, based on those many signs and symptoms that characterize frailty. But how do you manage if one has got hypertension and is having cardiovascular strain, okay, because of hypertension? So you have to monitor their blood pressure regularly, and then if possible, according to doctor's prescription, you can use a low dose antihypertensive in order to avoid hypotension. Okay, so you can also look at the drugs that the patient is taking. Okay, if they are the right dose and the likes, because we have mentioned that in the elderly, drugs may not work the same as in the adults. Okay, then chronic kidney disease, how it is linked to frailty is that chronic kidney problems may bring about electrolyte imbalance and also may bring about anemia. So how to manage this? You have to give patients electrolytes and also give patients some drugs or food supplements that will help to reduce the anemia. And also it is important that you also remember in the management of chronic disease, chronic kidney disease, that you need to avoid nephrotoxic drugs for patients with kidney disease. Okay, the other condition, a chronic condition that may bring about frailty is osteoarthritis. Okay, so when one has osteoarthritis, here it will cause pain. Okay, so when the elderly has a lot of pain, this will bring about reduced mobility, and with reduced mobility comes muscle atrophy. That is the association with the frailty. How you manage osteoarthritis is to do physical therapy, you do weight management, you can give non-steroidal anti-inflammatory drugs or painkillers, And if possible, when condition is, let's say it's turning out to be worse or so, you may do a joint replacement. Okay, then the other condition that is associated with frailty is depression. So for depression, its association with the client becoming frail is a strong bi-directional relationship. Okay, you need to know that frailty worsens with mood and vice versa. Okay, when one is depressed, they will start doing things slowly, okay, because of mental stress. So for patients with depression, ensure that they are on antidepressants. You can do psychotherapy and also bring about the social engagement in order to manage depression. Then diabetes mellitus. Okay, so its association with frailty is that it contributes to sarcopenia, neuropathy, and energy deregulation. Okay, so when one has diabetes, it brings or it contributes or it predisposes to sarcopenia. When one has diabetes, it predisposes to neuropathy and also affects energy production within the body. So how you manage this is you do a tight glycemic control, that is monitoring of sugar, okay, sugar levels, so that they are not too high. When they are too high, patient will feel frail or weak. If it's too low, patient is going to feel weak again. So avoid hypoglycemia, of course. In this patient, don't starve the patient. And also you can do resistance training and also do food care. Food care is very, very important also to prevent diabetic sores. Okay, food care, that is more like doing foot massage. Okay, client will put their feet on a certain machine and then to start vibrating to improve blood circulation. And as it improves blood circulation, it will reduce the possibility of having neuropathy, or just dipping your feet in water to improve blood circulation. Okay, then chronic obstructive pulmonary disease like asthma, it is also associated with frailty in the sense that it reduces oxygenation, and oxygen is needed for energy. So if there is less oxygen, patient is going to increasingly feel fatigued and it will limit their activity. How you can manage this? You can do a pulmonary rehab. Okay, so according to the condition, let's say if it's asthma, you can give bronchodilators. There is also pneumonia vaccination for the elderly, which you can do to improve lung health, and other oxygen therapy exercises like deep breathing can help you improve oxygenation to tissues. Okay, then the other chronic condition associated with frailty is heart failure. Okay, so severe cases of heart failure may lead to fatigue because the heart is the pumping organ of the body that pumps the oxygenated blood to all areas. So if it is not working well, it means all areas will not have adequately oxygenated blood. And if the heart is not working well, then patient will be prone to having edema and also metabolic inefficiency. Remember, blood carries with it nutrients, blood carries with it oxygen. So how then do you manage one with heart failure? The patient can be on diuretics. Diuretics, those are drugs that increase micturition or urinating. Patient can be on beta blockers. Patient should also be on salt restriction. This is to avoid sodium retention, which comes with its water. And all in all there, you can do a cardiac rehab. Okay, then other chronic conditions that is associated with frailty is a stroke. So stroke Its association with frailty is that it causes disability, it causes muscle weakness, and increases risk to falls. How you manage this is by rehabilitation of the patient using physiotherapy, okay, and also preventive falls from the patient. Then on the other condition, the last condition maybe that we can talk about as being associated with the frailty is peripheral arterial disease. So for peripheral arterial disease, here how it's associated with frailty is that it limits mobility due to claudication and tissue ischemia. If there is arterial disease, it will affect blood to reach other areas. So this will limit mobility and also lead to inadequate oxygen ischemia. Okay, oxygen reaching some areas. Then on management strategies here, exercise therapy. Okay, smoking cessation. Smokers are more prone to peripheral arterial disease problems. You can give statins, and also, if possible, you can do vascular surgery. Okay, so the key mechanism that links these chronic diseases to frailty includes energy deregulation. Okay, so if you have a disease like diabetes mellitus or heart failure, it is going to impair metabolic efficiency. Then the other key mechanism that links these chronic diseases to frailty is inflammation. If one has arthritis, okay, that which is chronic inflammation here within the joint, it will accelerate muscle wasting. Then the other key mechanism linking these chronic diseases to frailty is multi-morbidity to do with the disease. So synergistic effect of multiple conditions may make one become weak. You know, patient has anemia, depression, all these, you know, at one time, the patient may become frail. Okay, so now what is the management, or what are some of the management strategies for frail clients, for frailty? Okay, despite them having these chronic diseases, what are some of the management strategies? Okay, so as because like we are not doctors, we are geriatric care specialists, we are nurses. Okay, so what we can concentrate on are non-pharmacological measures that can be done. Okay, so for pharmacological intervention, of course, we will leave those to the doctor. But the non-pharmacological are important. Okay, are important because those are the interventions that we can bring in as geriatric care. As geriatric care specialists. So pharmacological intervention, let's say you can encourage de-prescribing. So de-prescribing here is avoiding polypharmacy. You have to prioritize medication that have the highest benefits to risk ratio to the patient. Remember, polypharmacy is a big problem in the elder, so de-prescribing. Then the other pharmacological intervention is targeted therapies. Okay, give drugs that will target the condition that is causing frailty. Okay, statins for patients with cardiovascular diseases, and also drugs for rheumatoid arthritis if patient has rheumatoid arthritis. Okay, so our measures, that is the non-pharmacological intervention, okay, because we are not prescribing any drugs for the patients, but we need to watch out that these patients may be on some of these drugs. Okay, we need to have that awareness. So the non-pharmacological intervention may include exercise program, nutrition support, multidisciplinary care, social and environmental modification, and then also looking at the challenges the patient may have, also looking at the emerging concepts that may also help for patients who are frail. So the exercise program here, we discussed in the previous lesson type of exercises that can be done for the elderly. So if, let's say, you are doing resistance training for these patients as one of non-pharmacological measures, this is going to improve muscle strength and metabolic efficiency. Then you can do aerobic exercises. Aerobic exercises enhance cardiovascular health. Type of aerobic exercises here, examples includes walking and swimming. Then you can also do balancing training. These will help to reduce falls for the patient. So do balancing training. Okay, all these we have discussed as exercises when we are dealing with exercises. Okay, then number 2, non-pharmacological intervention is nutrition support. On nutrition support here, you can give high protein diets to combat sarcopenia. Then give vitamin D or calcium for bone health. Then you can also address malnutrition. Okay, malnutrition and also other supplements that you can give for the patient. Then non-pharmacological intervention here includes also multidisciplinary care. Okay, so do a geriatric assessment to tailor the interventions. You do an assessment so that you tailor which interventions can be done. All these conditions that we have talked about may not necessarily affect the patient, but find out which chronic condition that the patient has so that you tailor your intervention. Then physical or occupational therapy, that is for those facing functional decline. You can do physical occupational therapy. Then the other multidisciplinary care has to do with mental health support for those with depression. Okay, then the other non-pharmacological intervention is social and environmental modification. Here, to do with social and environmental modification, it includes home safety evaluation at the place where this elderly person is staying. Ensure that you remove all hazards or encourage the support person to remove all hazards. Then the other social and environmental modification has to do with caregiver support and having community programs for these elderly patients to help for them to exercise and do everything that can necessarily help. Okay, then to do with challenges and considerations, in caring for these elderly patients, look at individual variability. Okay, look at individual variability. So frailty phenotypes may differ. Others may have a frail condition because of obesity, whilst others may have frail condition because they are cachexic. Okay, so we can have a cachectic or cachectic frail patients, those that have lost a lot of weight, okay, and they are frail. Okay, we can have those that are frail because of too much weight. Then the other challenges and consideration has to do with healthcare system barriers. Okay, healthcare system barriers, some of the challenges or considerations that are there includes fragmented care, that is for multi-morbid patients who need integrated model of care. Then the other challenges and consideration that we need to have for caring for these patients or this frail patient is monitoring. Okay, so to do with monitoring here, we can say there should be regular assessment of the gaits of the patient. Gaits, that is the stature, okay, stature of the patient, grip strength, okay, and this can help to track progression of the patient if at all they are gaining some strength. Okay, then it is also important to also note that there are emerging concepts in trying to help frail geriatric patients. That is, there is the punished inefficiency theory. Okay, so in the punished inefficiency theory is that frailty will arise when chronic disease disrupt energy optimization. So slower gaits, patients may try to slower their gait to conserve energy. So in the punished inefficiency theory, where frailty is arising because of the chronic disease disrupting optimization, patients in adaptation will slow their gait to conserve energy. So the interventions here should aim to improve efficiency. Hence, you can do resistant exercise training so that whatever is causing that, patient can learn to tolerate. Okay? Then, to do with other emerging concepts in care for this patient, there is the complex system approach. The complex system approach is a non-linear, small stressors that have disproportionate effect on the patient. Okay, so they can do non-stressor disproportionate effect exercises. Okay, so these will help the patient to recover or to learn to extend the parts that is being limited. So you can do Frailty exercises or exercises that will reduce that may reduce the frailty that has been identified. Okay, so from this discussion on chronic diseases that may bring about frailty and their management, some key terms or some key points that we have discussed is that frailty, it's a multifactorial condition that is often driven by chronic diseases. And then in terms of management, we have established that it requires a holistic approach where you have to treat the underlying condition and then also optimize nutrition and promote physical activity. Then the other key takeaway is that early intervention can prevent or reverse frailty in some cases. So the exercises, one, can start before they even become frail. They can start these exercises so that they will have strength as they age. Okay, so this has been my lesson on chronic conditions that may bring frailty and their management. So I'm saying thank you and keep studying.